we celebrated our 1-year anniversary of doing all of our Facebook Lives, and we're so excited about it. But starting in March, we're going to be venturing into some other platforms, so we hope that you follow us and support us.
Yep.
Oh, hi Tuesday. Hi, Shauna.
Hi,
yes.
Shauna.
Tuesday, exactly. So I hope that you follow us. We're going to be on YouTube. We are right now on YouTube. All of our videos are on YouTube, on the Facebook platform that you're watching now, Instagram, and then we're going to be adding TikTok. So we're really excited. But today we're going to be talking thank you, Shauna, for always following us. We appreciate it. Today we are going to be, hi, Debbie. Nice to see you guys. Today we are debunking myths about cholesterol. Debunking.
Yep.
So I'm Lori Rappy from Thrive Functional Wellness Center.
I'm Dr. Rappy from Thrive Functional Wellness Center.
We are here in La Quinta, California.
Windy La Quinta.
Windy. It's really windy today, but we do work with people all over the U.S., all over Canada. And yeah, we are talking a lot about today, like I said, debunking cholesterol myths and facts. So we both have little papers we're going to be looking at, but we're sharing lots of great information.
Great information.
You're going to want to share with your friends and family.
Yeah.
Disclaimer time.
This presentation is for informational purposes only. The information is not a substitute for medical advice from your medical doctor. The information is not meant to prevent, diagnose, treat, or cure any underlying health conditions. If you are concerned about your underlying health conditions, please discuss it with your medical doctor or visit your local ER.
Okay, done with the disclaimer. So, like I said, we are going to be debunking cholesterol myths. So we do have papers that we're going to be referring because it's a lot of myths, a lot of facts, a lot of truth. So let's just jump in. All right, you ready?
Ready.
Ready. Okay, here we go. Number one myth. Okay.
That's just not number one. It's not the number one.
No.
It's just the first on our list. So don't get confused and go, well, you said the number one. That's not how we're doing it. It's just on the list. Okay? So we won't use numbers anymore. It'll just be myth.
Okay. We're not going to use numbers.
No numbers.
So myth.
Myth.
The first myth. So people with high total cholesterol are more prone to heart attacks. That's a big one. That's a big one.
That's a myth.
Myth?
The truth is that young or middle-aged men with cholesterol levels over 350 are slightly at more risk of a heart attack. However, there are many other factors involved. Smoking, drinking, lack of exercise, obesity, carbohydrate intake. There's all this other stuff that goes into it. It says those who have cholesterol levels just below 350 are at no greater risk than those whose cholesterol levels is very low in the low 100s. For elderly men and for women of all ages, high cholesterol is associated with longevity and long life. You heard me right. Big study was done and they found that people had high cholesterol live longer than people who had low cholesterol.
Interesting.
Very interesting.
Okay.
And there's reasons for that. We'll get into that later.
So
that's
yes.
myth, first myth, second myth.
Yeah, so the second myth, and again, we are going to be talking about the benefits of cholesterol
yes, it's
too.
coming.
So the first one was a myth. So the second one, cholesterol and saturated fat clog arteries.
That's the myth. The truth is, research shows eating saturated fat does not appear to increase the small, dense LDLs. L stands for lousy cholesterol. Okay? It says in a few cases, the risk of plaque buildup even went down when people ate saturated fat. When people ate saturated fat, their LDLs actually went down.
Interesting. Right? Different information than what we're hearing.
You got to remember, special interest groups push a lot of propaganda. We're seeing that in other areas of healthcare right now, aren't we?
Yes.
Yes, we are.
Yes, we are.
Okay,
so that was a myth.
That was a myth.
Myth. The next myth is eating saturated fat and cholesterol-rich foods will cause cholesterol levels to rise and make people more susceptible to heart disease. Is that myth or truth?
That's a myth. The truth is, many studies show no relationship between diet and cholesterol levels. There is no evidence that saturated fats or cholesterol-rich foods contribute to heart disease. None, okay? As a matter of fact, as Americans have cut back on saturated fats and cholesterol-rich foods, because of the push by special interest groups, rates of heart disease has actually gone up.
Did you hear that? It's gone up, so it's the
Yeah.
opposite.
Just the opposite.
It's pretty amazing.
Special interest groups, right? You got that word, special interest groups? PETA, we're talking about you, not the bread, yummy bread. That's the other stuff. The PETA, the people. Okay, now watch. We're going to get attacked for that. I love animals. Are you kidding me? Come on. They're fabulous.
Okay, so that was a myth.
That was a myth.
Okay, the next myth, cholesterol lowering drugs saves lives. Myth?
That's a myth. There's no truth to that.
Big one.
It says, in 2 of the most recent trials involving over 10,000 subjects, cholesterol lowering drugs did not result in any improvement in outcomes. The research for years and years and years has shown the truth is, for men particularly, statin drugs only reduce your risk factor of heart attacks and strokes by 1%.
That's huge.
So when we go into the bad side effects and the bad things about statin drugs, you'll understand what we're talking about. So it's a 1% risk factor. That's it. That's nothing. It's not worth the side effects.
Yeah, that's pretty
We
crazy.
can do everything that they can do. We can do it better and naturally.
Exactly.
Yeah, with no side effects. None.
So, myth. So
Myth.
next myth.
Next myth.
Countries that have a high consumption of animal fat and cholesterol have higher rates of heart disease. Myth or truth?
That's false. That's a myth. There's no truth to that. There are many, obviously, there's many exceptions to this observation. It depends on a lot of things, but there are associations. It's called risk factor. Risk factor is not the same as cause. There's a difference. It says in wealthy countries where people eat lots of animal foods, many other factors exist that contribute to heart disease. Like I mentioned earlier, excess amount of carbohydrate intake, sweets, cookies, cakes, and pastries, and all that yummy stuff that are bad for us. Lack of exercise, this, what do they call it? The Great American Diet, right? Terrible. Our diet is terrible here. Alcohol consumption, smoking, lack of exercise, overstressed. All these things are contributing factors.
Yeah. Huge.
Yeah.
Huge. Big one. So
Big
those
one.
are all myths.
Those are all myths.
So,
There's no truth to any of them.
So since we talked about statin drugs, because
Statins.
that's a real big thing, and a lot of people are taking statin drugs
Lots.
to lower their cholesterol. So we are going to go there, and we are going to talk about the dangers of statin drugs.
Danger of statin drugs. All of this information is online. The problem is when you Dr. Google this stuff, you've got to be really careful what you read, because who's putting the information out there? If it's a pharmaceutical company, they're going to tell you that everything's fine, it's safe and effective, no transmission, you won't get sick, and we all know that's a lie. So you just got to be really careful with what information you're reading. So make sure you understand who funded the study or the information that's being put out. Okay, dangers of cholesterol lowering drugs. Statin drugs that lower cholesterol inhibit the manufacture of a specific enzyme that's needed for the formation of cholesterol in the liver. So they stop this enzyme from making cholesterol in the liver. It also, these same drugs, what they do is they stop the production of CoQ10, which is really important for us.
Right.
The enzyme inhibitors called statins are sold as Lipitor, Crestor, Atorvastatin, Zocor, Prevacor. There's a whole bunch of them.
And we all know people that are taking these drugs.
This is our favorite one. I'm only taking the smallest dose.
Right, or I'm taking it to be preventative because my uncle's cousin's brother's sister had a heart attack, so my doctor put me on it to prevent heart attacks.
Yeah.
And so when you hear the side effects, the doctor's going to go through and list a few of the side effects of these statins. You may want to stop and take pause.
Yeah. You might want to stop and take pause. Okay, so here's some of the big issues that we see happening. Weakness and muscle wasting. We see this a lot in the office with what we do. Hands-on people all the time. Yeah. It says this is the most common side effect from a statin drug, occurring in as many as 1 in 3 users. Muscle aches and pains, back pain, heel pain, weakness, slurring of speech resulting from statin interference with the production of CoQ10. Why? CoQ10 is needed for muscle function. You notice all those things were associated with muscle function. So if we take a statin, it destroys my CoQ10, which is necessary for muscle function. There's going to be a problem there.
Right.
In addition to that, these side effects may not show up until 3 years after you started taking the drug.
That's scary.
Yeah.
Yeah.
So
yeah.
people say, well, I'm fine. And next week is 3 years and 1 month, and they start slurring, and they got a droopy face and all kinds of weird stuff.
Yeah, because so often the side effects are happening. We may not
Right.
have a visible symptom at
Right.
the moment,
Correct.
but it's happening inside of our
That's
body.
correct.
Yeah.
The next one is heart failure. This is a great one. I love this one.
That's scary.
It says the rates of heart failure have doubled since the advent of statin drugs. The heart is a muscle, and it depends on a plentiful supply of CoQ10 in order to function normally,
Yeah.
which statins destroy. So you take a statin. Your doctor just says, "Here, take this." He doesn't tell you to take CoQ10. It's destroying all your CoQ10, and guess what? Heart failure.
Wow.
Wow.
Right. So we
Let me
have the
take
muscle
this.
weakness. Yeah.
We got a 1% reduction in risk factor. I'm going to take this, and it's going to give me heart failure. It's ridiculous.
Yeah.
It's just
Muscle
silliness.
weekness.
Yeah.
And yeah.
All that stuff. Muscle weakness,
Something to
aches
think
and pains,
about.
back pain, heel pain, slurring of speech. I've sat in the room doing a consultation with a husband and wife, and the husband will get up and go to the bathroom, and I'll say to the wife, I said, "How long has he had cognitive impairment?" She said, "Oh, it's been about a year." I said, "Did he start taking statins around that time or a year prior to that?" She says, he's been on a statin for a little over a year now.
Yeah.
Guess what? We have a nice conversation. They talk to their doctor. They make the decision. Let's try to see what we can do with our cholesterol without statin drugs. And they get off them, and boom, guess what happens? The cognitive decline disappears. I experienced this with my mom. She was having some memory issues and cognitive impairment. When I was back visiting, I went with her to the doctor. She was 92 at the time. And I said, "Why is she on a statin drug? For crying out loud, she's 92.
Yeah.
That's stupid." Plus, she was having issues. She got off it within a couple of months. Everything was back to normal.
It's pretty amazing.
Right. And there's a reason for that, and we're going to get to that in the reasons why cholesterol is important for us. Let's go to the next one. Cognitive impairment. There it is.
There it is. And
Many patients have reported memory loss and brain fog. We hear that a lot. Brain fog, including global amnesia. That means periodic or episodic issues where they'll have complete global amnesia. They don't remember anything for a short period of time. Can you imagine a pilot going through that in mid-flight? I mean, it's dangerous.
Yeah.
And then the last one is depression. We see this a lot in the office as well. Numerous studies have linked low cholesterol levels with depression and cognitive impairment. And that's just pretty straightforward. So 25% of all the cholesterol in your body right now resides in your brain. Your brain makes up 2% of your body weight. So your brain has to have cholesterol to function normally. In the studies that were done in the 50s and 60s on statins, what they found was low levels of cholesterol that people started developing cognitive decline and eventually went into full-blown dementia. Low cholesterol.
Wow.
Okay? Your brain needs it to function normally.
And we'll talk about the benefits. And so Debbie here says, Sean takes a statin. Should he be taking CoQ10? His numbers were 630. 630.
Yeah. So now there are some genetic diseases or genetic scenarios where people are just producing tons of cholesterol. That's completely different. We're not talking about someone. There's markers that you can run. There's genetic markers and special tests that you can run for this hypolipidemias and all that kind of stuff. We can identify. If they don't have any of those genetic markers, right, and they're not predisposed to excessive amounts of, boy, it got dark real fast, right? Excessive amounts of cholesterol, okay, then that's what we're referring to. If you've got genetic makeup, that's completely different.
Right, and we'll talk
Everybody
at the
on a
end.
statin should take CoQ10, period.
Yes, everyone that is taking that. And if you're interested in lowering your cholesterol, because it is higher, we're going to talk about how there's natural ways of doing
Correct.
it. So there's alternatives. So,
All right.
But we want to talk about some of the vital roles that cholesterol has
Right.
in our body. So let's talk a little bit about some of the
And
roles.
we've given a few of them already, okay?
Yeah.
A few of them already. It's important for brain function. This is when we do a consultation, when I'm talking to someone, I go over their blood labs with them. When we get to their cholesterol panel, I'm looking at a couple of different things. But most importantly is this. I expressed to them, I said, cholesterol is important for 3 main functions in the body that I think are the most important. Number 1, brain function. I just talked about that. If your cholesterol level is too low, you're going to start to develop brain dysfunction or cognitive impairment, number 1. Number 2, cell membrane repair. Every cell in your body is made of a lipid membrane around it. Lipids mean fat. Whenever there's damage to that lipid membrane, you need cholesterol to repair it. When we have damage to the arterial walls, right? Cholesterol is needed to repair it. That's why they are telling everybody, oh, cholesterol is where the plaque and cholesterol. That's not true, okay? And lastly is hormone production. Hormone production relies heavily on cholesterol, is one of the, let's just say it's one of the ingredients that we're going to need to make appropriate levels of cholesterol.
Right.
The best example would be sex hormones. Progesterone, testosterone, estrogens, DHEAs. Those are all really important sex hormones. When your cholesterol level hits 150 or lower, now we don't have enough to go around. So my body is in panic mode. Do I use it so I can remember that this is my wife and where I live?
Right.
Do I use the little bit of cholesterol I have to repair my cells so I don't get old fast? Or do I use that cholesterol so that I can make sex hormones? Even though I can't remember I got a gorgeous wife, I got sex hormones. So your body's really scrambling around to figure out, what do I do with it? I only have a limited amount, so too low is not good.
No.
Okay, so let's go through a list of some of these here. Cholesterol is a production for almost every cell. It's produced in every cell in the body. Cholesterol has cell membranes. We already talked about that. Cholesterol is a natural repair substance. We talked about it repairs the lining of the arteries as well as cell membranes. It's vital for the function of brain and nervous systems. We talked about all those things.
Right.
Bile salts are needed for digestion of fats, and it's made from cholesterol. So it's really important. Lastly, vitamin D. This was a good one. Cholesterol is a precursor for vitamin D formation, and it's formed by the action of ultraviolet UV B light and cholesterol in the skin.
So what I love about that one is it shows how our body is connected. We're always talking about that. For anybody who watches our videos and knows us, in functional medicine, we're always looking at the root cause, the underlying cause, and guess what? One thing being off affects something else. So the vitamin D, the sex hormones, the other hormone production, it's all connected.
Right.
So again, with us talking about these cholesterol myths, it's finding what your sweet spot is. We don't want it too low. We also don't want it too high.
Right.
And so when we run our blood work, the comprehensive blood work panel, we're able to identify the numbers. I know you're going to talk a little bit about what's the most important kind of, factors in that. But then the best part is we actually have holistic solutions for if it's too low or if it's too high.
Right.
So that's really, really important. It's not, about panicking. It's about let's identify where you're at right now, and then let's find those natural, holistic solutions for it. So
like Lori said, when we're looking at your cholesterol, we're looking at a snapshot of what's happening in your body right away.
Right.
And so if somebody is really anxious about their cholesterol, whether it be family histories and all those kind of things, there are additional tests that can be done. And for certain, we can look at particle sizes, which determine what your risk factors are. Do you have big, fat, fluffy cotton balls? Do you have little tiny hard knot BB shapes with like rust on them? I mean, there's ways we can do that. I mean, it's very extensive, but we look at it like this. The overall picture is what we're interested in, and we have solutions to help you bring your numbers into range, whatever that looks like. One of the most important things that I think we can share today is Harvard, which everybody would agree is a great university with lots of research that comes out of it. They did some research and they found what they believe is the most predictive scenario about heart attacks and strokes. And what they came up with is that triglycerides divided by HDLs is the most potent predictor of heart disease. Triglycerides divided by HDLs.
Okay.
Triglycerides are going to fluctuate based on insulin resistance and your intake of certain foods, because when I eat something that converts to sugar or glucose, it's going to be, if my body doesn't use it, it's going to be transported to liver and converted into triglycerides. So it's really important to understand the ratio between those two is the most predictive ratio that we can come up with a body, and it gives us a snapshot. And you should be below 2. So if your triglycerides are 100 and your HDLs were 50, you're at 2. We want to be below 2. Below 2, your risk factor is very low. Okay? So when we look at that, we'll see that, and then that'll lead us to make the specific changes and recommendations that'll help you get those into a better ratio and below 2, reducing your risk factor.
Exactly.
Okay.
Exactly.
I know that was a lot, but hey,
well,
it
you
just
know
comes
what?
out. I can't help myself.
It's good. You know, he's the expert that's reviewing the blood work, and that's why we do the comprehensive blood work panel. I talk about it all day long because it is so crucial, so important. We have to take that snapshot of where I am today. We have a lot of people come in and, oh, but I have this blood work from 3-4 years ago. Well, that was great for then. Do you think a few things have happened?
Anything changed?
In the last couple of years? Has your stress increased maybe because the world's gone a little nuts? So yes, we recommend, we personally run the blood work on ourselves every 6 to 8 months because we want to see what's going on. We don't want to wait for, as you heard us talk about, the symptoms, the red flags. We want to be preventative. So this is great information because you want to run the blood work, we want to get the information, and then we can customize next steps, holistic steps. We're looking at your food, we're looking at your supplements. So many people are taking so many supplements, they don't even know why they're taking it, they don't even know if their body's benefiting from it, right? And so we're looking at all of that. So
Good stuff, guys.
Great information.
Good stuff.
And so, a little announcement. If
announcement.
Yes,
Here
announcement. So, for the last year, if you caught our Facebook Live, I think it was last week, maybe the week before, losing track of time. And we talked about how this has been a year. We have Dr. Rappy and I committed to doing these Facebook Lives, coming live every Tuesday, and we did it for an entire year, and we're super proud of ourselves. And all of these videos are on our YouTube channel for Thrive Functional Wellness Center. It's here in our Facebook platform. We also have an Instagram platform, but we are changing things up a little bit. We're going to be coming live on other platforms, and I hope you continue to follow us because we're going to constantly bring value to you. We're going to constantly give you hope and show you that you should not settle for how you feel. If you don't feel good, don't just settle for that. And don't just settle for the medical model solution of, here's a medication, good luck to you. We do that deep dive, we do the blood work, and then we have customized holistic solutions for you. And if your neighbor comes, we have something specific for them.
Everybody's different.
That's how it works.
Everybody's different.
So this is our last Facebook Live. We'll probably pop on from now and then,
maybe,
but not on Tuesday. So I'm so grateful. Thank you for everyone that has followed us, that has been here. Look for us on all of our platforms because we're going to continue to share really great information about holistic solutions to your health. And again, as I always say, if there's a topic that you would like to hear us talk about, any questions, send me an email, call the office, DM us, message us, Facebook Messenger, all the things, and we can talk about them. Yeah. So,
thanks, guys. Appreciate it.
Thank
it's been great.
Yeah, it's been a lot of fun. And again, continue to follow us on all of our platforms because we're here sharing great information. And again, today is 2/22/22. And it's a really amazing day, and I hope you take a moment to kind of breathe it all in and do your gratitudes. And thanks, Debbie. I hope you have a great evening too, and you're very welcome. And we'll see you on our other platforms. So please follow, share our information as we continue to grow. And
not yet.
So excited. No, He's waving. Oh, Shauna, yeah, we can't wait for all those TikToks. It's going to be fun.
I got it. It's going to be great.
Yes, it's going to be a lot of fun.
Yep.
All right, you guys. Have a great evening, and we'll see you soon.
Bye.
Bye.